Hi, my name is Darrell Kem, and my son Nathan Kem was diagnosed with autism, about 5 years ago. And we did the OSU Medical Center, did an evaluation and a study on Risperdal and the effects of parent behavior modification training. And it seemed to go well. And we did that for about a year. And we've been on the Risperdal, and then the Risperdal we got off of it because of the tardive dyskinesia, and then we tried Abilify and all these other medications. But really they weren't working. They weren't bringing him back to kind of an even keel and making it so he could be successful in school. So we tried a more severe drug, Depakote, to try to get him to calm down. And it actually sent his white blood count to a critical level, and we had to take him out of school and take him off all of the medication. So over the last 5 years, basically, we've had more success once we brought him to Dr. Matt in the last 6 months than we've had in the last 5 years. And the nice thing is it's lasting effects, it's lasting results, because the medications are Band-Aids and they only work until they stop working. With what Matt's doing, it works and it stays with him because it's something that he's relearned to do. So the alternative therapies, while they are considered alternative, are only alternative because the folks that make the rules and talk about all of the traditional therapies like shock treatment and institutionalization and that kind of thing, that's your traditional therapies. And so I have no problems with trying alternative therapies, as they're called, but really they should be the mainstream therapy because that's what brings the success to the kids. My son is without medication, has been without medication for 6 months. He is a very bright little boy, and today he expressed to me for the first time with tears that he missed his mom. And that's not something that he's done before. Usually it ends in some sort of aggression in some way or another. So Dr. Matt's awesome. Thank you.
Darrell, one quick question for you. There was talk of tardive dyskinesia. So we sat him down for a minute and we counted how many different twitches or movements he had in 1 minute. And at one point we counted 64 in 1 minute. How many of those unwanted movements does he have now?
Don't see him anymore. And in fact, that was one of my biggest concerns, is I thought as a parent I screwed up again. Because I allowed him to be medicated with something that gave him more problems than he already had. In fact, I was looking at going to see a neurologist to have him look at what was going on with Nathan as far as the tardive dyskinesia. And just sitting and cuddling, he was just sitting and watching TV, and I took a video of him, and he was moving all over the place. The leg was twitching and that kind of thing. Don't see it anymore. Not at all. I mean, there's no medications. We never did get it diagnosed or looked at by a neurologist because we brought him to Dr. Matt and haven't seen it since.
Awesome. Well, thanks so much for sharing your information with us. We really appreciate it. And would you recommend somebody else to bring their child here that they have autism? Or
no, I wouldn't recommend it. I would encourage every parent, regardless of where you're at on the autism journey and what you've tried, I would encourage every parent to go back to baseline, bring their child to you, and let you see them, evaluate them, and help them to a road of recovery.